PHCRIS is a conference about making the most of research as a resource to improve primary healthcare outcomes.
The 2014 conference theme of integrating knowledge exchange to improve primary healthcare outcomes reflects the need to make research and knowledge exchange a core part of primary healthcare.
I think now we need to move much more into the domain of what I would call implementation science. What is it that works for whom? Under what circumstances, and are these interventions scalable?
So there needs to be some sort of coming together of research policy and practice to find new ways to utilise research to its best advantage to improve the quality of care and services that we want to provide in primary care to local people.
There's a real danger, I think, as we start to think about health services in smaller segments through a more powerful microscope asking, does this work, does this work, does this work? That what will happen is we'll lose the critical element of primary health care, which is the weaving together of all the different bits of health care and support around the patient and the family and the community, which is where it has to be done if there's going to be any kind of sustained impact.
We need to try to find new research methodologies that move away from providing the answers in 3 or 5 years' time to actually having some sort of real-time feedback of those findings to support quality improvement.
The problem is that we're stuck in a system which is obsessed with hospitals and with supporting hospitals and hospital care, and that doesn't allow primary health care really the full scope that it needs to be able to support people effectively through their lives as they look after the health and the health of their families and communities.
My hopes for the future in primary healthcare is that it remains a very robust part of our healthcare system. It is, in my view, the foundations of healthcare systems around the world.
I think if we can have a focus on quality of life, then we've done a lot with primary healthcare.